Good afternoon, everybody. Rich Fitzgerald, County Executive here, along with Dr. Deborah Bogan, the head of the Allegheny County Health Department. We're here to give our weekly update on the coronavirus, COVID-19. Allegheny County and most of southwestern Pennsylvania has now been in the green phase for about 5 days. We've seen many businesses open up, obviously including restaurants, nail salons, hair salons, gyms, other gathering places such as museums, galleries, etc. We want to thank everybody as our continued numbers stay low, and Dr. Bogan will certainly get into the details about the various 2-week periods where we've been able to monitor it. But up till today, even the numbers continue to stay low on the positive cases that are out there. We still don't know maybe yet the effect of what many of the demonstrations and protests have had thus far. The numbers do remain low, but we also know that when you have that many folks gathering closely, the risk is there, the potential is there. So we still urge people, certainly be heard in democracy and all the good things that we value as Americans, but the responsibility to still wear masks, physical distance as much as you can is really, really important. And that goes for a lot of things that seem to be happening now as we get into the warmer months and people have been indoors for many months. Picnics that are going on, again, bars and restaurants that are opening up. I will say I anecdotally saw a number of places over the weekend, I'm not going to name any of them, where I was a little bit concerned to see so many people relaxing maybe a little too much on the physical distancing and the mask. So we are still in a pandemic. We are still in a place in which there is no vaccine, there is no cure. And we do put people at risk, particularly folks that we come in contact with that might be elderly or have underlying health conditions. So we're opening up a little bit. We want to be responsible, whether you're going to a sports, for youth sports that are starting to have practices and things like that at this point. All those things that last number of months need to continue to be adhered to if we're going to continue to keep our numbers low and keep people as healthy as we can be. So with that, I want to thank everybody again for your continued support. Let's keep working together, and let me now turn it over to Dr. Deborah Bogan. Deborah?
Thanks, Rich. Good afternoon. As Rich said, our numbers continue to look good as we gradually reopen. We're pleased that we don't appear to be seeing a significant increase in our COVID cases due to the gradual reopening, in-person voting during the primary election, and from the large gatherings like the recent rallies and protests. The health department uses a variety of metrics to assess the effectiveness of our response to COVID-19, to tell us how the virus is spreading in our community, and to signal a need to us to modify our responses. And these metrics include the number of new cases, new hospitalizations, and our positivity rate. So how are we doing for each of these? Well, for the past few weeks, we've seen a decline in the number of cases, new cases in the county. The number of people hospitalized has also dropped. In the last week, we've had 5 new hospitalizations. And our positivity rate remains low. It has stayed at or below 5% for about a month. And for the most recent weeks, it's hovered between 2 and 3%. We continue to monitor all possible metrics and look for new metrics to use to assess our progress. Testing continues at our federally qualified health centers in Allegheny County. And since May 15th, the health centers and community clinics have administered more than 1,500 of the tests from Curative. And again, I want to remind people, anyone who wishes to be tested at one of these sites can schedule an appointment by visiting AlleghenyCovidTesting.com or by calling your nearest federally qualified health center. More information about testing and testing sites is available on the County Health Department's COVID-19 website. So as I said, we continue to see a decline in new cases, but we're watching where those new cases are coming from. So I'll share a little bit more detail about our new cases. Between May 21st and June 3rd, the latest 2 weeks for which the Health Department has complete data, our staff started investigations on 253 new cases of COVID-19. Of these, 11% are among healthcare workers, and about a third of these healthcare workers work in long-term care facilities. 26% are residents of long-term care facilities, And that is still a high number, but it's a significant decrease from the beginning of May, when more than 40% of the new cases were among residents of long-term care facilities. This can be attributed to some of the great work that our long-term care facilities are doing to slow the spread of the virus. Facilities are better at identifying symptoms of the virus early, getting residents and employees tested, and keeping employees home and residents cohorted to keep people safe. In the elderly, symptoms aren't always the common ones we think of, such as fever, cough, or shortness of breath. As we've learned more and more about the virus, we've identified symptoms such as loss of appetite and diarrhea that are common in the elderly. Preventive measures such as universal masking, temperature checks, and screening are working, and we're starting to see the benefit of universal testing being done at some of these facilities. So among the new cases, about half were linked to another known case or cluster of cases. 85 cases were linked to small clusters, and 70% of those were clusters at long-term care facilities. Workplaces accounted for about a quarter of the clusters, and all of these are small. So these numbers indicate that we're still keeping precautions to keep us all safe, so thank you. And as our economy reopens, so all good news. So I know I probably sound like a broken record, and I've said this at every one of our events. So remember, please wash your hands frequently, cover your coughs and sneezes with your elbow and not hand, clean frequently, touch surfaces regularly, and wear your mask over your nose and mouth. So please stay safe, have fun, and be kind. Thank you.
From WTAE. With the hot weather, are there ways people can keep cool, comfortable, and safe wearing masks in public?
So beyond common sense, I wish I had lots of great advice. Those masks are hot and they do keep you warm. I remind people in the hot weather to drink plenty of fluids, take breaks, stay in the sun, stay out of the sun and into shaded places as much as possible. And I wish I had more advice, but that's all I can really offer you today.
This question also from WTAE. As thousands of people continue to gather to protest, is there anything the county is doing or can do in terms of testing or contact tracing among these populations? Or is there any way to monitor folks to determine if there could be a spike in COVID-19 cases?
So as I said in our comments, we are continuing to monitor all of our cases carefully. We're doing complete case investigations on every case, as well as contact tracing all of those. And that's really important. We haven't seen an increase at this point, either from protests or any of our other large gatherings, so that's all good news. And I just want to remind people that if they're worried and want to get tested, there is testing capacity out there in our community. And if they go to our website, we have a link with on the map for all of the testing in our community. So I do recommend people wait about 4 to 5 days from their possible exposure to get tested, sooner if they have symptoms.
And this final question for the county executive. Can you give us an idea of how long we can expect to continue to do these briefings?
Yeah, I think it's important that we continue to do these briefings, and I know at times we often repeat ourselves from weeks earlier, but things are going to continue to change until we reach a point in which there's a vaccine and or a cure. We cannot be relaxing to the point where we're not considering this virus to be very dangerous and very deadly, because it is. So as we go through the summer months and we start talking about going back to school, sporting events, various things that are going to change and occur in our community, I think it's very important that we keep getting the message as things change. The health department at the state level today, and the governor put out some new guidelines when it comes to sports, and I'm sure as time goes on, there will be continued changes that are happening, medical breakthroughs that hopefully will occur, things along those lines. As we have, as Dr. Bogan said, some of the things that might be a delay of some of the demonstrations that have occurred in the last week. Those symptoms and that testing of positivity there may not show up for a number of weeks. And then the contact tracing that gets done by the health department to go find out where this may have occurred. Even the election, which occurred 8 days ago, right now we had 100,000 people that showed up to vote in person, in addition to the couple thousand people that worked and processed those folks for 13 hours through that day. We don't have any data yet that shows there have been any positive cases that have resulted from that, but there still may be a lag in time in which that may occur. So as things continue to evolve, and they do consistently, and we still continue to see on a national level close to 1,000 people a day who pass away from COVID-19, we need to make sure that we stay vigilant. You're seeing probably in other parts of the country numbers that are beginning to spike up. Places that had been previously low, maybe through March, April, and May, are now starting to, if they opened up too quickly and are doing things that might potentially spread the virus, are going to continue to do that. So I think it's really important that we hear from Dr. Bogan and her team every week to at least update folks, and obviously they update people as things change throughout the day, throughout the days, and the 11 o'clock briefing that goes out every day with the new numbers will continue to happen. We hope at some point we don't have to do this, but at this point we still need to get the message out that this is a deadly, deadly virus, and we've got to be very, very serious and really not relax. And as we've said many times, not take our foot off the gas. I want to thank everybody. There was another question, sorry.
This question from the Pittsburgh Business Times. Can you talk a little more about what the things you see or are worried about with restaurants and gatherings in the city?
Well, I just anecdotally was getting reports and saw some of myself that crowds came back. And that was obviously to be expected. People that hadn't been able to go maybe to their favorite spot for a couple of months were really anxious to get back out. And when things opened up on Friday night, Friday, Saturday, and Sunday, the weather was nice and people wanted to be out and gathering. We're very social people. That's what we are in a community that loves to get together and do those type of things. So we just want to continue to advise people to just be careful. Wear that mask. Keep your physical distancing if you can. If you do have symptoms, please don't go out. Please don't go out and if you have some sort of a fever or some sort of a sickness that you feel coming on, we want to keep people at home. I think the businesses, the offices, we've continued to see a lot of people working from home. We want to continue to encourage that as much as we can, and I think a lot of people have been very, very responsible in doing that. But we just want to make sure that we don't relax, and because we're in green, that people don't have to worry about some of the things that we've always talked about. So anyway, I want to thank everybody, and again, it's